Did you know that colon cancer is the third most common type of cancer in the United States? And yet, it often goes unnoticed until it's too late. It's a silent invader, quietly threatening us from within. This disease, prevalent and deadly, is often overlooked, brushed aside until the symptoms become too severe to ignore. The key to combating this silent invader? Early detection. It's crucial in turning the tide against this common enemy. With colon cancer, knowledge is your best defense, so stay until the end to learn the crucial red flags you need to be aware of and what you can do to minimize your chances of getting colon cancer. So, let's arm ourselves with some knowledge. Just 30 seconds into this video and you've already taken a step towards better health. Subscribe to our channel to continue receiving important information about your health. Now let's delve into the importance of early detection in fighting colon cancer. It's no secret that early detection can dramatically increase survival rates. But how much of a difference can it really make? Well, according to the American Cancer Society, the 5-year survival rate for localized colon cancer, that is cancer confined to the colon, is a staggering 90%. That's right, 9 out of 10 people with early-stage colon cancer live for at least 5 years post-diagnosis. But what happens when the cancer is found late? The story changes dramatically. The 5-year survival rate drops to 14% if the cancer has spread to distant parts of the body. That's a decrease of 76%, a sobering reminder of the importance of early detection. But it's not just about survival rates. Early detection also means more treatment options. At an early stage, surgery alone can often successfully remove the cancer. As the disease advances, more aggressive treatments like chemotherapy and radiation may be required. These treatments can come with serious side effects and significantly impact the quality of life. Furthermore, catching colon cancer early can drastically reduce the financial burden of the disease. The cost of treating advanced stage cancer can be significantly higher than that of early stage cancer, not to mention the potential loss of income due to extended time off work. So, you see, early detection isn't just a buzzword, it's a life-saving measure. It gives you the best shot at beating the disease, it opens up more treatment options, and it could potentially save you a significant amount of money. It's a simple yet powerful tool in the fight against colon cancer. Remember, early detection begins with you. It starts with being aware of the symptoms and getting regular screenings. Especially if you're over 50 or have a family history of the disease. Early detection can be the difference between life and death. It's as simple and as serious as that. But what does colon cancer look like? Sometimes it looks like nothing at all. Indeed, as we delve further into the hidden symptoms of colon cancer, it becomes clear that this disease is a master of disguise. Often the signs are so subtle they're easily brushed off as mere inconveniences. One of the most common hidden symptoms is a change in bowel habits. This could mean diarrhea, constipation, or a change in the consistency of your stool. It might be easy to attribute these changes to diet or stress. However, if they persist for more than a few days, it's time to consult a healthcare professional. Next, we have rectal bleeding or blood in the stool. Now, this might sound alarming, but many people dismiss it as a result of hemorrhoids or eating certain foods. While these can indeed cause bleeding, it's crucial not to rule out colon cancer. Remember, early detection is key, and blood in your stool should never be ignored. Unexplained weight loss is another symptom that often goes unnoticed. If you're losing weight without trying, it could be due to the cancer cells using up your body's energy. And while many might welcome unexpected weight loss, it's important to remember that if it's happening without a change in diet or exercise, it's a cause for concern. Feeling tired all the time or experiencing weakness and fatigue are also signs that something might be off. In the case of colon cancer, this could be due to the cancer cells using up your body's energy resources or due to blood loss causing anemia. These symptoms might seem innocent, even normal, but they could be a sign of something much more serious. So if you're experiencing any of these symptoms, don't dismiss them. Reach out to a healthcare professional. Remember, the best defense against colon cancer is early detection and prompt treatment. Your health is your wealth, and it's time to take it seriously. Then there are the red flags, the symptoms that demand immediate attention. Now we're stepping into the territory of symptoms that are more serious, symptoms that should be treated as immediate warnings. These are the ones that should have you picking up the phone and making that doctor's appointment without a second thought. One such red flag is severe abdominal pain. Now, we're not talking about the kind of discomfort you might feel after a large meal or from a bout of indigestion. We're talking about persistent, intense pain that doesn't seem to go away. This might be a sign of something much more serious, like a tumor growing in the colon. This type of pain can also be a sign of a blockage or obstruction in the colon, which can be a direct result of colon cancer. Let's not forget about anemia. Anemia is a condition marked by a lack of healthy red blood cells in your body. These cells are essential for carrying oxygen around your body. So when their numbers drop, it can lead to a host of problems like fatigue, weakness, and paleness. But how does this tie into colon cancer, you might ask? Well, if a tumor in the colon is bleeding, it can lead to a loss of red blood cells, causing anemia. These symptoms are serious and should never be ignored or pushed aside. They're your body's way of telling you that something is wrong, that something needs to be checked out. It's crucial to listen to these signals, to take them seriously and act on them. Remember, colon cancer is a silent invader. It doesn't always announce its arrival with loud, obvious symptoms. Sometimes the signs are subtle, easy to miss. But these red flags, they're the body's alarm bells, ringing loud and clear. So if you're experiencing severe abdominal pain, or if you've been diagnosed with unexplained anemia, don't wait. Seek medical attention immediately. Your health, your life, could very well depend on it. When it comes to these symptoms, it's better to be safe than sorry. Now that you know the symptoms to look out for, let's talk about how to keep them at bay. First and foremost, regular screening is vital. According to the Mayo Clinic, all adults starting at age 50 should have regular colon cancer screenings. These tests help identify polyps or abnormal growths in the colon and rectum before they develop into cancer. If you have a family history of colon cancer or other risk factors, your doctor may recommend starting screenings earlier. Regular screenings are not just for those at high risk, they are for everyone, because colon cancer doesn't always show symptoms in its early stages. Moving on, prevention extends beyond regular screenings. A healthy diet plays a crucial role in keeping your colon healthy. Mayo Clinic research suggests that diets high in fruits, vegetables, and whole grains have been linked to a decreased risk of colon cancer. These foods are rich in fiber, which aids digestion and can help prevent harmful substances in food from affecting your colon. So remember to put those leafy greens and colorful fruits on your plate. But it's not just what you eat, it's also how you move. Regular exercise is another powerful tool in the prevention of colon cancer. Physical activity promotes overall health and helps maintain a healthy weight, which is an essential aspect of cancer prevention. The Mayo Clinic recommends at least 30 minutes of moderate to vigorous exercise most days of the week. This could be a brisk walk, a bike ride, or even a dance class. Whatever gets your heart pumping and your body moving. Lastly, lifestyle habits like avoiding tobacco and limiting alcohol can also contribute to colon cancer prevention. These substances can increase your risk of colon cancer and many other types of cancer as well. Remember, prevention is always better than cure. So, take these preventative measures seriously. Regular screenings, a healthy diet, regular exercise, and healthy lifestyle habits are your best defense against colon cancer. Colon cancer might be common, but that doesn't mean it's inevitable. It's important to remember this. The power of early detection and prevention cannot be overstated when it comes to fighting this disease. The key is vigilance. Staying aware of your body, your health, and the potential symptoms we've discussed today. It's about being proactive, not reactive. It's about taking the responsibility to keep an eye on those red flags, those hidden signs that might otherwise go unnoticed. Remember, colon cancer doesn't always announce itself with a fanfare. It can be a silent invader, creeping up on you without you even realizing it. But once you know what to look for, once you understand the importance of early detection, you're already one step ahead. So, don't wait. If you have any concerns, any worries, don't hesitate to consult with a healthcare professional. They're there to help, to guide you, to provide you with the information and support you need. You have the power to take control of your health, to make the choices that will keep you healthy, to take the steps that will protect you from colon cancer. It's not about living in fear, it's about living with awareness. It's about understanding that your health is something you have a say in. Your health is in your hands. Make sure you're doing everything you can to protect it.